The normal fundus. The fundus is that part of the bladder lying immediately about and beyond the trigone. Its surface is somewhat irregular, even when the bladder is full, and when the organ is not fully distended, the fundus may be thrown wrinkled in folds of considerable depth. For a proper examination of this surface, it should be fairly well upon the stretch. Then it appears as a relatively pale mucous membrane covered with interlacing small red blood vessels. The region about the angles of the trigone should be most carefully examined, as this is the point of origin of most primary papillary tumors and saccules, while here also may be seen the most intense evidence of tubercular and other inflammations. To examine the fundus fully, the ocular end of the cystoscope should be depressed and the instrument pushed until it will go no further, or until the light becomes obscured by a fold of bladder wall. The instrument is then withdrawn again toward the trigone, and, both going and coming, it is rotated gently from side to side, so that the eye sweeps across the whole base of the bladder. The normal vault. The cystoscope is then turned over until its prism points directly upward. In the rather dim distance, one sees the pearly bubble of air that floats at the top of the water in the bladder and forms the center from which our observations radiate. From this center, one withdraws the instrument, moving it a little from side to side, and inspecting the bladder wall until the bladder neck comes into view. Then back to the bubble, and a lateral wall is inspected as the instrument is slowly swept downward until the trigone comes into view. The opposite wall is then covered in the same way, and finally the ocular end of the instrument is elevated and the instrument pushed inward until one has seen all that remains of the bladder wall beyond the bubble. The appearance of the wall of the normal bladder is the same at the vault as at the fundus.